Hi, happy Tuesday, everybody. It's Dr. Chris here, Dr. Christine Anderson. I am a chiropractor in Los Angeles for about 30 years now, and I have a family practice. So I help kids and families grow up healthy. And I love doing that because it's, I don't know, it's like the best. I just love what I do. So I started this series in the beginning of the year to help with patients and people with the things that they can do that they can take control of with their health. And one of them is sleep. So this is huge. And you can go back to my first episode, which is the 7 Facets of Health, where I talk about these 7 aspects that help you be the healthiest you can be. And sleep is a big part of that. So in this presentation, I'm going to cover what constitutes adequate sleep, the effects of sleep deprivation, and effective ways that you can enhance your sleep naturally, right? So please share this with your friends and your family because you want them to enjoy optimal health too. So if you're out there watching live, say hi. And if you have any questions or comments, you can go ahead and type those in the chat at any time, and I will do what I can to help out with us with that. So, 1 in 3 of Americans suffers from some type of sleep issue, and that might even be a generous estimate because I think more do, but just don't end up seeking help. They try to manage it themselves. So regular poor sleep on a regular basis puts you at risk of serious medical conditions if it is chronic, if it keeps going on. And that includes things like obesity, heart disease, and diabetes. But the biggest thing is that it shortens your life expectancy. You really need sleep, and you need good quality sleep. So I'm going to go into a general rule of how much sleep we need. For adults is usually about 8 hours, and it actually increases the younger you are, it makes sense because brains and bodies are developing. So as a general rule, if you wake up tired and spend your day like waiting for a chance to lie down and have a nap, then it's likely that you're not getting enough sleep or enough good quality sleep. So that's the difference. And after several sleepless nights, the mental effects of not getting enough sleep become more serious. So it might start out like brain fog, you might have trouble concentrating, you might be grumpy, you might not be making the best decisions, and then you may start to even develop depression or even start falling asleep in the middle of the day. So it's not going to be a good situation, especially if you're maybe driving and you start to get drowsy and fall asleep, or if you are having some sort of physical work that you're doing and that occurs. So if it continues, the lack of sleep can affect your overall health and, like I said, make you more prone to those serious conditions. So fun fact, the longest recorded time without sleep is approximately 264 hours, which is 11 consecutive days. That's crazy. I don't know how they did that. And I can't imagine the state that they were in when they finished that. So it's not really clear how long we can survive without sleep, but it doesn't really take that long till we see the effects of sleep deprivation. And anybody who's a mom might know this, or a parent. I certainly experienced this after my second child. He was not letting me sleep for about 10 months. And when I came out of the fog, once I started getting sleep, it was incredulous that I was able to function during that time. So it only takes 3 or 4 nights without sleep when you can start to hallucinate. So I'm glad I'm out of that now, but it's a bit crazy when you're actually in it. Sometimes you don't even realize how bad it is. So we've talked a little bit about what can happen if you don't sleep, but let's talk about the benefits of sleep, because if you know what these benefits are, you're going to try and do what you can to get it. Um, the biggest thing is that during this downtime of sleep, your brain is going to kind of reorganize what's gone on during the day. It does a lot of reorganization. There's actually an immune system in our brain that becomes active. There's repair and regrowth of tissue. So throughout the day, as you're doing things, if you're exercising, you could be breaking down muscle, so there needs to be repair there. It's going to build bone, it's going to build muscle, and it strengthen your immune system overall. But a lot of the stuff too is going on in the brain itself, which has its kind of own system. Another effect of proper sleep is keeping slim and trim. So studies have shown that people who sleep less than 7 hours a day tend to gain more weight, and they have a higher risk of becoming obese than those who get at least 7 hours of sleep. And it's because of a couple of chemicals that go on. There's something called leptin, which is the chemical that makes you feel full. And then there's another chemical called ghrelin, and that's a hunger stimulating hormone. So when you don't get enough sleep, you get too much ghrelin and you don't get enough leptin. And so you're going to tend to overeat. Plus, the longer you're awake, people will overeat for energy, quote unquote, and there's more hours to eat in. So it's definitely going to contribute to that. Sleep boosts mental well-being. So especially with people have anxiety or depression, and they looked at how long they were sleeping, and if most of them are sleeping less than 6 hours a night, they're going to have an increase in their anxiety and depression. It prevents heart disease, which is the number one killer in America. So this seems to be associated with an increased heart rate, an increase in blood pressure, higher levels of chemicals linked with inflammation, and that's going to put strain on the heart. And I talk in depth about having an optimal heart health. I can link to that episode so you guys can check it out. Preventing diabetes. So studies have suggested that people who usually sleep less than 5 hours a night have an increased risk of developing diabetes. And missing out on a deep sleep state may lead to type 2 diabetes, which is the one associated, it used to be called adult onset, but now we're finding this even in children. And this is because it's affecting the way the body processes glucose, which is what we use for energy, but our bodies can become resistant to having that glucose in our system. Like, it doesn't recognize it anymore. Increased libido. So another reason to get your sleep. And along with this, men who suffer from sleep apnea, which is a condition where you stop breathing for a period of time, also tend to have lower testosterone levels, and that can lower their libido. And there's a lot of other reasons. That's not the only one, but there is a relationship there. And kind of piggybacking on that, if you are trying to get pregnant, getting enough sleep will increase fertility. So this is having to do with the secretion of reproductive hormones. So everything's tied in together. And as I said, the sleep needs are going to decrease as we get older, but still, even as an adult, we need 7 to 9 hours. So when people say they only need, 3 hours of sleep, they may be fooling themselves. Maybe they can, but most of us need 7 to 9. Teenagers need 8 to 10. Children 6 to 12 years old need 9 to 12 hours. Children 3 to 5 need 10 to 13 hours, including any naps. And children 1 to 2 years need 11 to 14 hours, including naps. And infants that are 4 to 12 months need 12 to 16 hours, including naps. So a lot of sleep. The younger you are, the more you need sleep. And our sleep rhythm is actually an internal biochemical process regulated by things like our neurotransmitters. So I want to talk a little bit about them. And I know a lot of times you'll hear a lot of things about serotonin and 5-HTP. And yes, serotonin can promote both sleep and wakefulness, which can also decrease REM sleep, which is a stage in the sleep cycle I'll talk about. So it's a little tricky with serotonin, and that's the whole thing of like the tryptophan, which is one of the amino acids you need to make serotonin. So the whole Thanksgiving thing of eating turkey, which has tryptophan in it. I don't eat turkey, but this is where you get that. Another issue with serotonin can be in women who are perimenopausal or menopausal, because one of estrogen's main roles is to promote serotonin. So it depends on the age too about what's going on. And this is the thing, is that this isn't a one size fits all, but it just kind of gives you a bigger picture so you can kind of see maybe which aspect might be something you can work on. GABA is actually the largest sleep promoter. It's the mellow out neurotransmitter, and it tends to have a Valium effect, so a nerve sedating effect. There's also acetylcholine that can affect REM sleep again, but it's also a wakefulness promoter. And dopamine downregulates melatonin, so it's a wakefulness promoter, especially in the morning when our cortisol is supposed to be higher. So all of these neurotransmitters, which are chemical messengers in our brain, need to be in balance. And the way you do that is to have a good balance of amino acids. You can take a supplement that provides specific amino acids necessary to make certain neurotransmitters, and that's usually what I help people with, because these neurotransmitter messengers, they take the amino acids, bring them together, have the message, and it degrades. So it's not something, you can't take a neurotransmitter and have it be effective. You have to take the building blocks. So I actually have a neurotransmitter assessment form that if you're interested in, I can send you and you can fill out, and you can see if there's any support you need for your neurotransmitter system. All right, let's just move quickly on to the stages of sleep, and then I'm going to get into some things that you can do. So there's 4 stages, and in stage 1, it's going to be 5 to 10 minutes. It's the beginning of the sleep cycle. It's relatively light, and it's that transitional period. So this is where you're going to start making theta waves. And in theta waves, you can also be awake. And there are some people that will produce too many theta waves, and they're having issues with that as they go about their life. They feel sleepy, like they want to go to sleep. All right, so that's stage 1. Stage 2, you're going to start becoming less aware of your surroundings. Your body temperature is going to drop. Your breathing and heart rate slow and become more regular. That lasts about 20 minutes. And your brain is going to start producing these rapid rhythmic brainwave activities known as sleep spindles. And this is where we spend about 50% of our total sleep is in this second stage. The third stage is our deep delta sleep. Our muscles are relaxed, our blood pressure and breathing rate drop. And this is when you don't hear noises, you're not being responsive, the world is crashing down around you and you do not hear it. This is deep delta sleep. And this is the most important sleep because a lot of people are not getting to this deep sleep. And this is where if someone woke you up, you'd be like, where am I? What's happening? And as we get older, we tend to sleep more lightly and get less of this deep sleep. So if you're older, you might need some support into transitioning into this deep delta sleep. And for that, I use something called a brain tap. And I forgot to grab it from my office today, but it's a headset that has lights in both the ears and the eyes. and there's programs you run with it. And there are different programs depending on what you want to work on, including getting to deep delta sleep. So it's something I use in the middle of my day as sort of a reboot. And that's where I'm concentrating more on my alpha relaxing waves, and then at night on the delta deep sleep. All right, let's get to the sleep disruptors and their the things you can do for them. So first of all, random sleep schedules, not a good idea. Having a set schedule and trying to get to bed before midnight, around 10 p.m. is perfect, but definitely before midnight, because if you are getting to sleep after midnight, even if you get 7 to 9 hours, it's not going to be as restful as if you get to sleep before. And that has to do with the energy of what's going on in the earth. You want to try to do this on a regular basis, whether it's the weekday or the weekend. Now, there's going to be this whole lighting situation. So as the day goes on, it actually the light spectrum actually goes to a warmer hue. Think of sunsets with the reds and the oranges and the yellows. So if you are using light in the house, if you are using electronic equipment, they are going to have a blue light emitting from them. Now, blue light isn't necessarily bad if it's used at the beginning of the day, because this is going to be something that's going to get our stimulation of our cortisol going, and we don't need melatonin at that time. But if you are going to use electronics or artificial lighting in the evening, it's going to suppress your melatonin levels. And that's the hormone responsible for making us tired. And this actually is best triggered first thing in the morning. If you can get out in that early morning light, that light actually starts a melatonin production that you're going to need later on in the day in the nighttime. It's pretty crazy. So you want to turn off any bright lights 2 to 3 hours before bedtime. If you can get the type of lighting that's yellow or orange, that's even better. You want to basically turn off all electronics 60 to 90 minutes before you go to bed. So you don't want to actually be on your computer as you go to bed. And besides the fact of having that blue light coming at you, which you can mitigate with blue light blocking glasses. And I do recommend as the day goes on, you should be wearing them. Like I should be wearing mine right now, but I'm not. So turning off those electronics is important, because if you're working on something, it keeps stimulating and exciting your brain to keep going, and you're not getting those signals to kind of wind everything down. I know this has happened to me. I'm tired. I'll go, oh, I'm just going to do something quick. And, 3 hours later, and it's 11 o'clock, and I'm like, oh my God, I've got to get to bed. So I'm trying to get out of the habit of turning anything on and getting into bed with a book and, using that time to sort of wind things down. Try not to nap during the day. And I'm talking about big naps. If you need like a 20-minute cat nap, that's fine, nothing longer. Or if you want to meditate, great. But if anything, if you're sleeping too much, you're not going to be tired to go to bed at a reasonable time. The condition of your situation for your bedroom. So if it's too hot or it's too cold, you're not going to sleep as well. And you want to have it around 65 degrees. A few other things on that for your sleep environment. Have it be pitch black. That's going to be the best for your melatonin production. If there's noise, wear earplugs or use a white noise machine. You want a comfortable bed and pillows so you're not tossing and turning all night. So just make sure everything is optimal for when you go to bed. All right, let me scroll back up here because I want to talk a bit about things like caffeine. So caffeine can be an issue because it helps keep us going. But if you rely on caffeine to keep yourself going, it's a stimulant. And so it gets to be nighttime and you can't wind down. And it's just like, great, now what am I going to do? And there's some people that say, oh, I have coffee right before bed and I can go to sleep. Well, I wouldn't necessarily brag about that because it can actually mean that your adrenal glands have shut down so much that there's no more adrenaline left to pump out there. But rather than relying on caffeine, you want to do things that are going to promote natural energy, like ginseng and other adaptogens. And there's definitely some research on that. High dense nutrient foods. So no junk snacky foods, but things that have a lot of nutrition in them, plant-based things, things that are low in sugar. You can use essential oils and aromatherapy to pick you up, music, exercise, which is a great thing to do. And I've got my nitric oxide releasing exercise that takes not even 10 minutes. It's a very quick routine that you can get everything going as if you had just worked out in the gym in just a few minutes. You want to make sure that you hydrate enough because if you're dehydrated, it's going to make you feel lethargic. Stress. So this is the principal cause of insomnia, right? We lay down, our monkey brain is going, oh my God, you're playing out your day, you're playing about what you have to do tomorrow. All this stuff is going on that you're thinking about, that you're ruminating about, and you can't get to sleep. So this is huge. And I did a whole segment on stress management, optimal stress management. So I'll put the link to that too, because you should watch it. I don't want to go into too much detail, but stress releases cortisol. If cortisol is high, then it's very hard for melatonin to be high. So cortisol levels should be high in the beginning of the day and drop down. Your melatonin should be low in the beginning of the day and rise up. And so it's an inverse relationship. But if your cortisol is pumping all the time, how are you supposed to relax and release and let go and, chill out? So we definitely do not want that. So there's a few things that you can do to kind of offset this. Number one is to maybe journal about your day, look at your list from the day before, cross things off, and then make a list for what you need to do the next day. And that way, if you're laying there thinking about things, you could be like, I've already taken care of that. I don't have to worry about it. It's all set. I know what I have to do tomorrow. And if this occurs for me, I kind of picture taking my brain out of my head and putting it in a little velvet lined black box and being like, you need to just relax now, like time to go to sleep, just shut down. And I shut the lid, and that visually helps me. I also will meditate. I will also use my essential oils. I will also use meditation apps or listen to a podcast or something else to try and get out of my head if all those other things are not working. And of course, regular chiropractic, because that will help release stress throughout the whole body, mind, body, spirit. Okay, just a few things about kind of vices or things people will use. So people say, well, I'm going to have a drink to help me sleep. Alcohol will make you drowsy. It is a sedative, but then it's going to keep you from getting to those deep stages of sleep. I talked about actually the deep delta sleep. The next stage after that is the REM sleep. And that's the one where we are dreaming and more active. And so that is going to be, you won't get to that stage with having alcohol. And after it wears off, it has a stimulating effect. So it's going to shorten your sleep and you end up waking earlier. And then you're usually cranky because you didn't sleep enough. So if you have a drink, stop drinking alcohol at least 4 hours before bedtime. Nicotine, it also is excitatory. It's a chemical. It's excitatory, but smokers can also experience withdrawals in the nighttime after about 3 or 4 hours of sleep. And then they can be tossing and turning or want to wake up and have a cigarette. Antidepressants suppress REM sleep. Decongestants often have like uppers in them. They might have some caffeine in them, so you have to be careful. Eating too close to bedtime, so you want to wait 3 hours after your last meal before you go to bed. Because you're digesting while you're sleeping, and so you're not renewing and repairing. You don't want to do that. It can also cause heartburn and reflux if you eat too soon and lay down. Then there's things like a high glutamate diet, which is very excitatory, a high histamine diet. I'm not going to talk too much about them. Just realize that the foods that you eat are chemistry, they're chemicals. So some people have to get up in the middle of the night to pee. Okay, that's fine as long as you can. It's like one time and you can get back to bed and go to sleep, no problem. But you can try curtailing liquids at night. But the other thing is that if you are dehydrated and then you start to drink water, your kidneys are going to process that liquid a lot faster. So if you keep yourself hydrated throughout the day, you're going to have actually less chance of having to wake up at night to pee. Other issues might be benign prostatic hypertrophy. So if that's continual, just get that checked out. All right, so I talked a little bit about sleep apnea. If that is occurring, which it's quite common, 22 million Americans have this issue, you want to talk to somebody about doing a sleep study because you need to be able to breathe. That is very dangerous. And it's also related to obesity. So if you're overweight, you want to lose weight. All right, I'm almost there. Thanks for hanging in with me. The last thing I want to talk about, there's a couple of points, but the major thing is Wi-Fi, EMS in general, even electricity in general. So we need to have a break from this bombardment of electromagnetic forces and radiation while we're sleeping. Because if we're surrounded 24/7, it's going to disrupt the repair system. It's going to start breaking down our DNA and aging us. So the best thing to do is turn your Wi-Fi off at night or put it on a timer. Now, I know it's not everything, and we have Wi-Fi and signals coming in from neighbors, but it's at least a start, and really get used to putting your phone on airplane mode anytime you're not using it. The other thing is just taking out all electronics from the bedroom. So nothing plugged in. That is the best thing. No alarm clock, nothing. Anything that's plugged in, put it in a different room. If you have to have your phone there, don't plug it in, keep it on airplane mode. And if you don't want to keep it on airplane mode because you might need to have it for a call, put it in a different room. You'll still hear it ring. Baby monitors are another source. Alarm clocks that are plugged in. Portable phones. So the ones that are landlines, but they're still plugged in and they're portable. So just get all of that out. And if you can, you want to possibly look to shielding your bedroom from that outside source of EMF. And that's another show, and I will be talking about that soon. I've been doing a lot of research on it, and there's a lot out there on what EMF in general does, never mind the 5G that's starting to roll out. Any type of pain is going to help keep you from sleeping. If you've ever been in pain, you know this. So you want to address the cause of the pain. Of course, chiropractors are great for that. Make sure before you go to bed, you can do massage, stretching, foam rolling, do your regular core exercises, and then you can use natural remedies such as magnesium, homeopathic remedies, essential oils, and that type of thing. All right, sleeping pills. So if you're resorting to sleeping pills, they actually can have a paradoxical effect. First of all, they may work temporarily, but they're going to disrupt your normal sleeping rhythm. And usually people who use them kind of feel hungover the next day because they didn't really get that deep sleep. Then they can also become immune to the effects and they might not work so well. And the insomnia usually gets even worse when they try to get off of them because the sleep is just totally out of whack. So if you can not use sleeping pills at all, that would be the best thing. CBD is the cannabinoids, and that interacts with our own endocannabinoid system, which helps your body maintain a state of balance and stability, which is also called homeostasis. So the more I learn about CBD, the more I love it because it helps with all our body systems. And we don't have to really think about it. It can be used proactively to keep yourself healthy and balanced, as well as use it if you have issues. So, pretty much, I'm seeing everybody can benefit from some level of CBD. Um, Studies suggest that CBD can help with both falling asleep and staying asleep. And CBD may offer an option for treating different types of chronic pain. So, just like I was saying before, if you're in pain, you're not going to sleep. So, they have done studies in 2019 looking at whether CBD could improve sleep and or reduce anxiety. It helped. It helped with pain in a 2018 review. It helped with patients who had Parkinson's. The CBD helped improve symptoms of a REM sleep behavior disorder, where a person acts out their dreams. Topic for another day. But that's associated with poor sleep and nightmares. And so they've tried using CBD for helping this. It seems to have helped. So I'm going to link again. I'm not going to go into CBD in great detail, but I do have a CBD Basics YouTube video that I'm going to link to if you want to look at that. And right after I finish this, and we're going to wrap it up, I am going to be doing on my Young Living with Dr. Chris channel a whole segment on using essential oils to help with sleep. So if you want to just switch over to that, I will put the link there. If you have any questions, you can let me know right now. You can put it in the comments later. You can get a hold of me through my website. Hopefully this is helpful. If you do like this, go ahead and give me a thumbs up and like it. Share it with your friends and family so they too can have optimal sleep. And subscribe if you would like to know when I am posting new videos. All right, everybody, until next week, have a great one. And yeah, let's live our optimal life.